My name is Nick Taylor and the title of my talk is Can we get people home early after joint replacement surgery? And if we can, what's the trade-off? When I was a new graduate physiotherapist in the early 1980s, the standard time rest in bed after joint replacement surgery was 7 days. However, progressive surgeons allowed their patients to get up after 5 days. The average length of stay at that time was around about almost 3 weeks. So the rationale was that patients needed to be kept in hospital to manage their pain and to manage any post-operative complications, and also to make sure that their mobility was safe before going home. There's also probably an attitude that people were more likely to be resters rather than movers. So what are the trends in length of stay after joint replacement surgery since that time? A study published a couple of years ago has got data about knee replacement and total hip replacement for 21,000 patients in the UK. It shows that since 1997 to 2014, both total knee replacements and total hip replacements have reduced length of stay from around about 14 to 16 days to around about 5.5 days. Those reductions have been associated with reduced costs, and the trend was not explained by any change in patient characteristics. That's in the UK. What about in the US? This is data from the US from the years 2009 to 2011, a very large number of patients after total knee replacement. They reported that 75% of their patients 10 years ago with total knee replacement had a length of stay of less than or equal to 3 days. And within the cohort, length of stay was associated with factors such as age, sex, race, and insurance status. The issue though, so it's clear that length of stay has been trending down, but are the reductions in length of stay come at trade-off of complications? It's an article from Sarpong. This is looking at data from 2006 to 2010 to 2000 up to 2016. It's showing a reduction in length of stay of total knee replacements in the US down to about a mean of about 3 days. The interesting thing is that association between, there's also been, in the same time, there's been a reduction in complications, including total complications and specific complications such as DVTs and urinary tract infections. These findings are consistent with reports after total hip replacement also. So the logical conclusion of the ever increasing reduction in length of stay after joint replacement surgery is to have outpatient surgery, and that is in fact what's been happening. In 2009, Berger reported that it was feasible. They got 94% of patients scheduled for total knee replacement home on the day of surgery, with a relatively small number of readmissions. The data for outpatient surgery has been synthesised in a large recent systematic review published by Bemelmans. They're looking at both hip and knee joint replacement, and the intervention was outpatient surgery compared to inpatient management, and the primary outcome was safety and efficacy. It was a very large review with 41 included studies, none in Australia, with including more than 40,000 outpatients and more than 1.2 million inpatients. Only one of the studies was in a randomised controlled trial. In terms of adverse events first, including leakage, wound leakage, urinary retention, and pneumonia. The top panel, we have total hip replacements. The bottom panel, total knee replacements. The line of no effect is there. This side of the line means the odds favours outpatients, and this side favours inpatient management. We can see that there were reduced odds of adverse events after total hip replacement here, and there was no difference in odds of adverse events after total knee replacement. What about serious adverse events, including things like death, sepsis, coma, intubation, and stroke? we can see that there was no increase in odds of serious adverse events after outpatient total hip replacement or total knee replacement. Next, looking at readmissions. We can see here that there was a trend to reduced readmissions with outpatient total hip replacement and also total knee replacement. In terms of demographics, the patients receiving outpatient surgery were younger, had a lower BMI and lower ASA, so they were fitter for surgery. In terms of patient-reported outcomes, there were 7 studies reporting outcomes on pain, quality of life and function. They reported no differences at time points ranging from 30 days to 1 year. Costs were reported in 6 studies. They all reported cost savings with outpatient surgery, but they were from the health service perspective. Another very recent study published is that by Fassihi and colleagues on total knee replacement, looking at US insurance data from 2007 to 2017. 84,000 patients with a total knee replacement ought to be included needed to have follow-up data at 1 year. The first thing is to note the increasing trend for outpatient surgery, represented by the green line, and the trend for reduced rates of what they call traditional surgery, which was discharging people at day 3 or 4. Their main finding was that there were no difference in complication and revision rates. Outpatients were more likely to be male, have fewer comorbidities, and to be non-smokers. We can see here that looking at data from outpatients discharged at day 1 or 2 and discharged at day 3 or 4, there were no differences in manipulation under anaesthetic, in infection rates, revision rates, or loosening rates. An interesting finding was that they reported that 42% of their outpatients were aged 70 to 79 years. So although they were younger, they may not have been that much younger. Are there any buts from this positive story about outpatient surgery? Well, there is a selection bias in that the patients tend to be a little bit younger and they tend to be healthier, so you'd expect they might go a little bit better. You could address this by doing an RCT, but there's only been 1 RCT located to date. However, that RCT reported results consistent with the large case series in the systematic review. Is there any cost shifting? Although there's cost savings from the health service perspective, preliminary data suggests there's no increase in post-operative contacts with the healthcare system as well. Another issue that arises is why not reported more in Australia? Are there funding disincentives in Australia? Or is it cultural? That means that outpatient surgery doesn't seem to be done as much here. The one thing that seems to be very important with early discharge after total joint replacement is having excellent post-operative care. And these criteria, these guidelines for enhanced recovery after surgery have recently been published in order to get people safely home in 0 to 3 days after joint replacement surgery. And they include excellent perioperative care, including things like having excellent pain control measures to prevent blood loss, infection, nausea, and focusing on early mobilisation. So in conclusion, can we get people home early after joint replacement surgery? An emphatic yes, in 0 to 3 days. What's the trade-off? Well, there appear to be more benefits rather than trade-offs. There are reduced costs, and there are no differences or possible benefits in reduced complications and readmissions. However, the caveat is you do need excellent perioperative care. Thank you.